To see statewide COVID statistics heading back down, it's important to know it's going to take a while before our numbers become even more manageable. It's also likely Omicron will not be the last variant we see. We're joined live tonight by Dr. Karl Fernandes. Dr. Fernandes is a critical care pulmonologist and partner of the V Project. Thanks so much for joining us tonight. Let's start off by telling us what you're seeing right now in the hospitals and the ICUs where you work, and how are the staff coping with this?
Well, right now in the ICUs, we're still seeing a lot of patients, a lot of very critically ill patients. The majority, over 90%, are unvaccinated. They have comorbid conditions such as diabetes, obesity, hypertension. And so even though the overall numbers seem to be plateauing and even going down, what's happening is that the patients who are in the ICU are still there fighting for their lives, and the staff are still taking care of them. And unlike in March of 2020, the staff, a lot of patients and families are very appreciative, but we're seeing an increasingly number of patients, families being, aggressive, rude, saying, that they've done a lot of research and not being respectful. And, our staff has been working the same hours that they've always worked, very hard. They're sacrificing their family life, their personal life, their sometimes their vacations in order to help take care of the patients. Again, these are few families, but it's happening, and I wanted to get that message out.
Yeah, I have heard that as well from other doctors and nurses, even on social media. And you guys don't deserve that. You guys have been working these long hours, dealing with people who are dying and having to inform their families for 2 straight years now. Do you think that some of that has to do with the reported minor symptoms of Omicron and maybe just not connecting the dots to why some people are in the hospital fighting for their lives while others seem to maybe have more like cold symptoms? What do you make of why you're getting those reactions?
So we saw this actually over the summer, this sort of trend of aggressive families, non-respectful families. A part of it, even before Omicron, was just people, this whole debate has become so politicized, which we try to avoid. And part of it is grief, families, whether they're guilty about not getting vaccinated or may have given their loved ones the disease. They say, and it's been accelerated with Omicron because, yes, it is a milder illness overall, but when the sheer numbers of Omicron have overpowered sometimes our resources. I never thought the day would be when we've come close to running out of ventilators and other equipment. Never saw that in my career. So I think it's a mixed message here. Yes, Omicron may be milder, but overall, the sheer numbers are still there. And what we see, again, is even the numbers go down. We see, the hospitalizations 2 weeks later start going down, and then the deaths still occur.
And Doctor, thanks so much for sharing that perspective. Maybe some people have some regrets about not getting vaccinated, and we know that the ones who do get vaccinated are not the ones that appear to be going to the hospital in those large numbers, according to some of the research that we're seeing. We appear to be on the downswing of the Omicron surge. Real quickly here, we have about 20 seconds. Is this going to be the last variant we have to deal with, or not?
I doubt it. Viruses mutate, and in general, if you look at the history of viruses, they become less virulent, but they're also more infectious. And I think that's what we're seeing with Omicron. The infectivity rate is higher, even if the virulence rate is, and the mortality rate may be less.
Dr. Fernandes with the V Project, thank you so much for your time tonight. And of course, we appreciate all that you and doctors and nurses and hospital staff have been doing for more than 2 years now. Thank you.
I appreciate getting the message out. Thank you very much.